I started taking Fix. Actually, I know the date. It was September 8th of this year. And I took it strictly for fat loss, weight loss. And within the first 3 weeks, I lost almost 10 pounds. And I have been on a weight loss journey since forever. But August of 2024 is when I really got serious. And from August until September of this year, I had lost 60 pounds, which is great. Bravo to
Wow.
me.
Yeah,
Yeah,
congratulations.
thank you. But when I got on the Fix, I'm sorry, I'm on both. I'm on Fit and Fix, which helps, I feel like the jiggly fat from the other. Anyway, we'll go there. But when I got on the Fix, the numbers that were going down, I lost 20 pounds in 2 months. So if you do the math there, I did 60 in a year, 20 pounds in 2 months. That blew me away. So that's why I got started on it, but that's not why I'm on it anymore. Yes, I need to lose more weight. I need to have more fat loss, all those good things. I have still a journey to go, but I have a lot of autoimmune issues and inflammation and some really bad things that have kept me from doing life, to be honest. And these drops have been a miracle. I don't have the inflammation I had. I'm off of all my pharmaceuticals. I'm not kidding. So by month 2, I went off of a sleeping medication. I'm not going to name the name. I've been on it for 5 years and I take
Wow.
the maximum dose. I'm off. And I fall asleep now when I go to bed. That's not what I used to do. I would lay there and it would, even on the sleeping pills, I would have to okay, schedule a time, take the pill, go to bed. I'm relaxed now at night and my body tells me okay, you've had enough today. It's time for bed. You lay down. I conk out. I fell asleep talking to my best friend the other night on the phone. No, this doesn't happen to me. I mean, weird stuff. No, not weird, beautiful things. So beyond that, that's, sleeping. I have nerve pain from autoimmune diseases or disorders. And I was on a heavy dose of a pharmaceutical. The most you can take as a human. I'm off. I don't do
Wow.
that anymore. I also get nerve blocks for occipital and trigeminal neuralgia. Mine was supposed to be Friday. I didn't need it. I didn't go. I canceled my appointment, and that's in your skull for facial pain and back of your. Didn't go. I'm feeling better. I mean, it's incredible. I had a frozen shoulder from a arthritic thing that I could not even lift this arm like that for 5 months. This is
You
my
go, girl.
yeah. So anyway, but I reached out to you, Terry, because I am really passionate because I don't have a large intestine. I have 6 inches left of large colon. I had something happen to me when I was 30. I'm going to be 56. They removed almost all of my large intestine. I have 6 inches left. And that's your gut. That's where this works on your vagus nerve and the whole thing. And as we know, and when I reached out to you, I said, if this is working on me, we can't make claims, but I can't imagine how it's going to work on people who have their entire colon and gut system and all the things. So I'm just blown away because I could go on. My gums aren't bleeding. I don't have scabs behind my ears. I don't have scabs in my head. Skin flares. My hair is growing back. My husband even noticed yesterday, said, you know what? There's less of your hair in the drain because he's the cleaner here. I'm not the cleaner. Sorry.
Yep.
But he was
Yeah.
like, there's less of your hair in the drain. And he's noticed, sorry guys, men don't typically notice things, but he even said, your hair looks more thick. And he's noticing things. And even on himself, because he's taking, not what we're talking about him, but he has not taken his belt notch down in 20 years. He works out every day as one of those lucky guys who's like the same weight in high school. Blah, blah, blah. Yeah, I know. It's like, oh, you poor thing. But his belt went down a notch after, many, many years. And I was like, wow, that's incredible. So he's doing Fit and Fix also, and we're on the greens. The greens are fabulous. We
Yeah.
take our drink every day. And the other thing I'm gonna end, because I know I'm babbling unless you want to keep me going. I bought, now this is a big deal, and I'm not going to say the name. So a name brand spray that numbs your skin for, if you're having pain. That's all I'm going to say. I'm sure y'all, it has green writing on it. I bought 3 of those cans a week. So in California, that's $45 a week at a pharmacy, over the counter. So that's almost $200 a month. I just noticed yesterday when I had to put my Amazon order in, oh, I'm not using that. So I'm not using that. That you don't even know. I live on that. I bathe on that. That's my signature scent, and it's not good. If y'all know what I'm talking about. It's very pine folly.
And did you take that because of inflammation? I mean, obviously it had to do with pain, but
Yeah.
joint pain, what was it
Yes,
for?
it was for joint pain because I have a certain type of arthritis that attacks your joints and your skin.
Wow.
So I have pain where sometimes just to numb the skin or numb the, it's not really doing anything but a mental thing. But I'd have to do something. And then the RLS, I had restless leg syndrome at night. That was all the prescription meds off. I don't have that anymore. I mean, it's incredible. It's just,
Awesome.
yeah, incredible. And I mean, do
That's
I still have some things? Sure, but not like it was. And I want to cry because it's just, my life is changing and it's going to change even more. I just know it. I'm noticing little, like my scabs in your nose. I mean, people who don't have them, it's a problem. Like that's terrible when one comes out and the next one comes back and then looks like you're picking your nose. Anyway, sorry, just being real.
wow. That's I mean, obviously that is life-changing stuff. I would love I see Dr. Ben on here as well, Byron. I would love to ask Dr. Ben about the colon thing. Did you have a question, Byron?
No, go ahead, Dr. Ben. If you, he might not be in a position. Well, he doesn't turn his video on, but I see that he's on there.
Yeah,
Yeah.
I have an ileostomy and then a takedown. So they reversed it, which if all you don't know, an ileostomy is where you get a poop bag in so many words. I was 30 years old. I'm now going to be 56. And they blamed that on a virus that attacked my entire immune system. So I struggle with that every day. There's a syndrome called postherpetic neuralgia. I'm probably not even supposed to say that, but that pain I live with every day. That's why I'm spraying myself. That's why I'm in pain 24/7, except when I'm sleeping. But this is
Oh,
going away. I'm not,
wow.
yeah, I don't even know what to say. Hi.
So Ben, I mean, if you want to comment on any of that, but the thing that really is curious to me is about the length of the colon, the large intestine,
Yeah.
and how that relates in her case into other people. Is that a thing or is that not a thing?
Well, when you think about the vagal system, and we know there's over 500 different connection points just through the digestive pathway, and then there's more that come into the immune system, which is the protective lining of that digestive pathway. And as I listen to Vicky's history, medical history here, and I'm listening to all this, I'm going, yeah, I'm sitting here telling my wife, it's this, it's this, it's this. I can read what that is just because of what I'm hearing, all the things that's happening to her body. Now, think about all the things she's saying that has improved since she's just started back on these drops. I think it was September 8th, if I remember correctly, that you said that, Vicky. And the issue that we're seeing here is it's reconnecting the gut back to the brain, and now it's reconnecting the repairability phase back into the gut and the brain. And now all these things, as they're turning back on, are starting to say, oh, we got to get rid of that. We got to fix this. We got to go repair that. And that's the pathway that she's on right now. It's the communication was off. Think about a cell phone and having a static connection. And that's why she could not carry on a good communication in her systems. And that turned into an autoimmune system, meaning that she was never getting out of stress in the sympathetic nervous system. Her body was in stress 24/7. She never got into rest and repair, digestion repair, all those factors. So these drops, as we've said, they don't fix anything. All they do is turn back on the communication system so the body in its God-given ability can start communicating back to really what's happening and goes, oh, well, let's clean this mess up.